Congratulations on receiving your pair of KorShoes to go with your Mediliev Touch hybrid stimulator device. Right? These KorShoes are a therapy accessory, and one size fits the large majority of people. You can see that the bottom of the therapeutic KorShoe has these touch points as well as 6 therapy points. And as long as your foot is touching 3 of those application points, you're still going to get a great treatment option. All right? This is used to treat the lower limb below the knee, all the way to the foot, the bottom of the feet, and even the toes. And our instructional video is going to go over a few different options you can use to be able to get therapy and rehabilitation to painful symptoms of neuropathy, increase that circulation, or other foot and lower limb conditions. Now, these suggested applications that we're going to go over, none are better or worse than the other. They're just a different way to be able to get a different treatment option as needed. So try which one works best for you.
Now let's take a look at what's inside your KorShoe VA kit. You'll find some extra snap electrodes. And upon opening your box, you'll find the pair of KorShoe applicators, an extra set of snap cables. You'll want to get out some water in either a spray bottle or a damp cloth, or use the conductive solution that's included, which are going to be able to hydrate your feet to be able to get a better outcome in your treatments. Now, after you have all your items set up, you can use one set of snap cables. It doesn't matter if it's the black or white set of cables, and you're going to attach it to the snap connector that's at the bottom inside of each KorShoe shown here. Now, the end wire, you'll get that end of the electrode lead wire, and you're going to plug it either into side A or side B. It does not matter which one. Now, let's go over some suggested application and placements. The first one, you're going to be using one set of cable lead wires, and you're going to hydrate the bottom of your feet and attach your shoes inside of the KorShoes. And you can see one set of wires is connected. So this example, the white end, one goes to one shoe and one goes to the other. Another option, you can also hydrate the shoe with the conductive spray or water. Either one works. Now, you want to have your feet firmly placed on the KorShoe conductive spots to have at least 3 of the 6 covered, and make sure your feet are touching the entire time to get the therapy. Now, another option is we're going to introduce the other set of electrode wires. And for the example here on your screen on the left, is you'll see that the black set of wires is attached to, one is attached to the shoe, one is attached to the inside of the ankle. The white set of cables on the right side in your view, one of the white connectors is to the shoe, the other is just above the ankles. Now, if your symptoms are to the outside of the foot, you can set up that same setup, except have the electrode placed on the outside of the foot, more towards the outside of the ankle, if your pain and symptoms are more to the outside of your foot, to the bottom of your feet. Neither of these are better than the other. It's just a different option depending on where your symptoms lie. Now, a third option is we're going to use 2 channels, 2 wires and 2 sets on one leg. A lot of times people have painful neuropathy symptoms going down their leg, and there's a very powerful nerve that's right on the top of our calf to the outside of our leg, just below the knee. It's called the peroneal nerve. And if you follow this application set by putting one of the set of wires, this one happens to be the black set, where they each attach to electrode, and you put it in this placement here, and the white set is connected to one electrode by the ankle, the other by the shoe, you can get a great treatment there to the whole bottom of the feet all the way up to below the knee. We highly encourage that you look at your quick start guide or your instructional guide, which will give an in-depth description of each of the treatment options so you can choose what's best for you. Now, if you have painful symptoms of neuropathy, plantar fasciitis on your lower limb below the knee or to your feet, we do highly encourage that you start off with, at the very bottom of your Mediliev Touch, the microcurrent. It's a subthreshold treatment, meaning that you don't feel it as much, but it really preps the pain pathways and helps as part of your rehabilitation treatment and your pain treatments. And a really good go-to, which we highly suggest, is suggesting Pain Combo 4, which has a great combination of treating the nerve pain as well as improving circulation and rehabilitating the areas of the foot. We also encourage that you explore some of the other treatment options as described in your quick start guide and instructional guide and find which one works for you. Enjoy your new KorShoes and your Mediliev Touch device.